We all know the QL muscle is a very deep, thick core muscle, but one of the most important things to understand about it is its attachment sites and how that affects the way that we move. So because it's attached to the ribs, it deeply affects inhalation, it deeply affects our breathing. Because it's attached to the hips, it's a huge part of how we move from our core and how we move from our base of support. And then lastly, because it's attached to the spine, it's going to affect the nerves that come out of the lumbar spine, bleeding into both the hips and the legs, and also the digestive tract. Because of this last fact, I like to start work on the QL by pushing the density of the fibers away from the spine. So sinking in through the erector spinae group and visualizing all of that thoracolumbar fascia that is restricting a lot of movement down in the low back and the pelvis. I want to think about sinking down deep and sliding out laterally, making sure that you're making room for any new nerve flow and allowing the release of connective tissue. Issues in the QL usually arise from overcontraction or the condensed nature of the low back. So it tends to be really tight, and what I want to do is lengthen that out. I can do this by pulling the arm up at 180 degrees and then pulling their legs to the opposite side of the table. And what that does is pulls the ribs up superiorly and pulls the hip down inferiorly, opening up some length in the QL and allowing for more detailed work. Now I'm going to start my search, and I can do this with either my thumbs or my fingers, but I find that an elbow is great for pressure, but it's really hard to feel what's going on. So with my thumbs supported or my fingers supported, I want to methodically move through the QL and see what I can find. Communication is essential, as always, but I want to make sure that what I'm feeling correlates with what the client is feeling, and if it's not, that's very normal and that's very okay, but just be in touch with what they're wanting and what you're feeling, and talk about what your plan is and think about how to correlate that with their goals. If I indeed find a trigger point, which is really common to do in the QL holds lots of trigger points typically. If I do find one, I'm going to use my elbow. It's really a thick muscle, and so using my thumbs or using my fingers can wear those joints out. But I want to review trigger point therapy very quickly, mainly because I feel like there's a couple things that are important to understand in the success of trigger point therapy. A client's mind and body are not always in sync, and so when I find something, it may not be what they feel, or when they feel something, it may not be what I find. So when I find a trigger point, I'm going to communicate. Does this feel like it's the right spot? Do you feel like I could move up a little bit? Do you feel like I could move down a little bit? And even starting to rotate in tiny increments. I'm talking millimeters. You want to make sure that you're right on that spot. Every different angle can produce a different effect. Once I'm on this spot, I want to ask my client to breathe, and I fully believe in visual cues here. When I ask my client to take a deep breath, I usually ask them to breathe in right to that spot, and as they exhale, I have them scan and make sure that they're really letting go of everything in their body and visualize that muscle depleting and releasing from its surrounding tissue. Sometimes lengthening the QL and digging in can be a little too intense, and so I want to do the opposite for that client. And in this instance, I'm going to actually pull their shoulder down and then raise their hip up. So that does the opposite. It's going to bring their rib cage closer down to their hip and their hip closer up to the rib cage. This softens the muscle, and as I start to sink in here, I'm using my right hand to do the work, and I'm using my left hand to provide a little bit of traction on the ribs and manipulate the ribs softly so that it's melting the muscle, and I'm able to very gently bring awareness to the lower back as opposed to dig in and fight my way through. Sometimes if I have a client that's having a really hard time letting go, I like to suggest this visualization. If I know the pain that they're feeling is therapeutic and good pain, I ask them to think about actually inviting that pain in as opposed to trying to block it out and just observing it. So as they observe it, where does it go? What does it feel like? Where does it radiate? Is it, what kind of pain is it? And then I explain that when we don't block the pain out, the pain has nothing to latch onto. It doesn't have that tight muscle to hold onto, and so it's got nothing, and it lets go. Bringing my client back into a neutral position, what I want to do next is practice a PNF on the QL. This is a little bit tricky because we're actually holding farther away from the actual muscle, but what I want to do is pull down on the ankle, and then I'm going to ask my client to pull their hip up towards their shoulder against my resistance. So that contracts the QL, it engages it, and then when they release, I pull down on the ankle, giving that hip some nice traction and allowing the QL to unravel. Getting my client into side lying, I'm going to put my hands on the table and ask my client to scooch back. That way they don't fall off the table. Then I'm going to have them reach their top arm up, reach their bottom leg close to the table up towards their chin, and extend their top leg down. Once I've got them undraped, I can now do all the same work that I did with them in the prone position. So from this angle, I'm just accessing these fibers slightly differently and making sure that I'm really thoroughly opening up this muscle. Using my body mechanics to pull away from as opposed to lean into, I'm going to pull the connective tissue away from the spine, freeing the nerves that extend out and possibly are impinged in this area. I'm going to focus on the attachment sites along the hips and the ribs, disconnecting some over-adhered tissue. And I can also focus on some trigger point therapy in here. I can access this muscle from different angles, and so perhaps now I can access trigger points that I might have missed with my client prone. There are some great spinal stretches to do from this angle, but I just want to concentrate on allowing the QL to absorb all the work I've done. So as I hook into the hip, pulling toward me, and into the scapula, pushing away from me, I can settle that muscle into place. One last side lying stretch while I have my client already here. I'm going to pull their top leg out posteriorly and then drop it down off the table. And I'm going to have them reach up with their left hand and grab onto the corner of the table. From here, I just want to accentuate the stretch. Oftentimes the leg dangling down can be enough, but this can just open up the entire lateral aspect of the body. QL, glute medius, lats, triceps. It's a great way to finish this work. Thank you for watching. Thank you for supporting my channel. And if you haven't yet subscribed, please subscribe and pass it on to a friend. Hopefully we can get some more massage therapists out there to contribute to this community and continue to raise the bar of respect that we have earned in this career.